Good morning, everyone. Welcome to the launch of the Digital Health Market Report, second edition. Really pleased that you could all join us this morning. We're just going to give it a few seconds to let people log on and connect and get their coffee and their tea sorted. Whilst we wait for everyone to join in, I'm just going to give a little shout out to Jade Cummings. Jade is in the virtual gantry today. She'll be the one that keeps us on track. She'll be the quiet voice in my ear to make sure that we don't overrun. We're starting in a few seconds, and we have until 11:15, and then your regular programming will continue. So thank you for joining us. We hope you've got your coffee and your tea sorted, or if you fancy something stronger at this hour of the day, then by all means, feel free. And in honour of every government briefing that's taken place during the pandemic, we are adopting the next slide please approach today. So Jade has control of the slides. I'm hoping that everyone's on now, and that I've filled in the top of the hour to enable everyone to join. Jade, could we have the next slide, please? So I'm Martin Bell. I run my own consultancy now, the Martin Bell Partnership. And LaingBuisson originally in 2017, I think originally, asked me if I'd write what was the first edition of the Digital Health Market Report, LaingBuisson's first foray into both the NHS and also into digital health. And then during 2020, they asked me if I would write the second edition of the report. So we have published that now. It's been available for a couple of weeks. If Jay would just like to go back to the previous slide. The Digital Health Report is now out. It's available for you to buy. We have been able to offer discounted rates for the NHS, for public sector and for charities. And the book contains a whole range of stuff. And if you can't plug the book at the book launch, when can you plug it? So just briefly to cover off, it contains a whole load of stuff about the NHS, about regulation, commissioning, the providers, the different sectors, so acute, mental health, community, primary care, etc. It does also touch on private health, the care sector, and it covers payers, it covers commissioners, it also, of course, covers absolutely loads of digital health. It is, if you wish, the Sunday roast of reports, whether you're into your Yorkshire puddings and roast potatoes, your meat, your peas and carrots, or whether you prefer the vegetarian or vegan option. There's everything in there that you could possibly want, plus, of course, lashings of digital health gravy, covering it all and making it tasty. So without further ado, let's move on to the panel if we can, Jay. We're joined today by a very esteemed panel. We have Dr. Alasdair Emslie, who is the Chief Medical Officer of Lloyds Bank. We have Jocelyn Paulley, who is a partner at Gowling, WLG. And Lloyds Bank and Gowling WLG are the very kind sponsors of this second edition of the report. We're also joined by two of the digital leaders who contributed an interview to the book, Liz Ashall-Payne, Chief Executive of ORCHA, and Dr. Dustyn, both a GP partner and indeed the Director of Primary Care IT. And they will all introduce themselves in a bit more eloquently than I have, and also share some of their own thoughts on digital health. So Jade, if you'd like to move to the next slide, please, let's get started. So since the first edition was written, and it came out in the spring of 2019, so it was largely written during 2018, the world has significantly changed for all of us. And here we are, in fact, doing a virtual launch. The launch of the first edition certainly involved considerably more wine than this one does, and was a physical event held in London. The good thing about this virtual event is that so many more people can join us. So there may be less wine, but there are more people, which is very nice to see you all. So Jade, if you'd like to move to the next slide. So we really have seen over the past year, and I think this is worth touching on, COVID has really impacted the globe. And these are obvious statements, and I'm sure many of you know these statistics, but over 100 million cases globally, over 2 million deaths. In the UK alone, we've had in excess of 100,000 deaths. COVID has impacted many people's lives, many of the lives of those who are still living in terms of the loss of family members, friends, people that they know. I myself, touch wood, did have COVID before Christmas. It was pretty grim, and I certainly wouldn't wish it on anyone. And not that I had much time for the hoaxers and deniers, but I even have less time for them now. We've also seen, however, the knock-on impact of the measures of the stress on the NHS, the pressures on beds, on staff, in terms of other health and economic impacts. Obviously, the most significant downturn in the economy actually back to around 1700. We've had cancelled operations, cancer waiting lists, and indeed other waiting lists rising substantially, increase in mental health issues. There's been a range of problems, for example, perhaps one of the most topical ones at the moment, and many of you may be experiencing, homeschooling and the impact on children's education. So it's not just the direct COVID issues, it's also the indirect COVID issues. Next slide, please, Jade. And I couldn't really hold this event without just taking a brief moment to pay tribute to all of the NHS staff, all of those working in the care sector, and indeed all key workers in terms of the huge effort, sometimes at great personal cost, that they have put in over the past year. And a special thank you, I think, for all of the NHS digital staff, all those NHS IT staff, all of those health informaticians, all of those information technology staff who have really done their very best to support, to provide, and to upscale the digital technology that is available to the health service during this pandemic. So let's get into a few thoughts on the report, shall we? Thank you, Jade. So it's without doubt that we have seen a massive rise in the use of that very broad term, digital health, healthcare technology during this past year. Statement of the obvious, you all know that. We've seen huge numbers going through NHS 111 from the pre-pandemic period. We've seen a massive increase in online consultations and assessments. We've seen huge uptake in terms of Microsoft Teams platform being used within the NHS for meetings. Although whether perhaps moving from back-to-back physical meetings to back-to-back video meetings is a sensible working practice move, I guess remains to be seen. We've seen huge increases in the usage of the telephone in terms of GP appointments, for example, and a significant move away, as was required, from the from face-to-face meetings, certainly at the height of the first round of the pandemic. If you move to the next slide, please, Jade. We've also seen some of the cultural changes. So we've seen a reduction in some of the barriers. NHSX, one of the most useful things it did was perhaps issue some guidance to free up some of the information governance restraints that existed beforehand. We've seen technology that was in place significantly upscaled and adopted. I'm thinking, for example, of shared care record usage. For example, the Connecting Care programme down in Bristol. Significant movement from thousands of record accesses a month to tens of thousands of record accesses a month. We've seen more simple things, such as an increase in laptop, or more straightforward things rather than simple things, in terms of the increase in laptops, in terms of home working. We've seen significant increase in terms of technology across a panoply, including some early stage technologies like remote monitoring, such as some AI, although that's still perhaps significantly in the hype phase rather than the reality phase for many, starting to come through. If you move on to the next slide, please, Jade. The technology hasn't had it all its own way. Some technological things have gone backwards. For example, online appointment booking, due to the need to take control, has gone back from a relatively low base. We talk about digital health. I'm going to say this as a statement. The big winner, the biggest winner of the past 12 months is the 170-year-old telephone. It's been scaled and penetrated deeply into the delivery of healthcare. We've also had some debacles. We had the issue of the English NHS COVID tracing app, 2 goes. very expensive, 35 million compared to what other countries have spent and been able to roll out. And of course, touching on AI again, whether it was entirely an AI problem, I'll leave for others to judge. The AI debacle, which perhaps put that technology at the forefront of the public's mind in a larger way than any amount of Twitter or LinkedIn posting could possibly do. Jade, next slide, please. And we've seen some players emerge in different parts of the landscape. This is the vendor landscape as we define it, and we put different categories of where people are. In those traditional, those perhaps more mature technology spaces, such as electronic patient records, certainly in the United Kingdom, we've seen strong performances from the likes of Cerner and System C and indeed Epic. As expensive as it is, it has moved forward significantly. We've seen lots in the patient flow and workflow space. So people like Alcidion, people like MedXnote, other patient flow solutions supporting discharge out into the community or back to home. And we've seen a lot of activity in what is often referred to as that digital health space, those new companies that are in either in the startup phase or are been around for a while, but have actually found significant growth during this period because they have the technologies to grow them. So whether that be traditional players like EMIS Health, TPP, iPlato, all of who gave superb responses in terms of supporting healthcare in terms of the pandemic, or some of the newer players in the market like Willola, Livy, AccuRx, which we'll talk about later. They've all responded and come up, but not everyone. Next slide. Thank you very much. So just touching on that traditional base, because the report does cover new markets and, shall we say, more traditional markets. There's a lot of data in the report, and just for those that are into their data, all of the data has been re-baselined and re-researched and revalidated. So all of the data that is in the report is fresh and new. And I mentioned earlier that the likes of Cerner and System C, perhaps especially, have still managed to benefit during the past 12 months, and certainly the couple of years since the first edition was released. And yet still we do have something in the region of 16% of UK hospital organisations, whether they're health boards or acute trusts, with no actual electronic patient record. So it shows that growth in those traditional sectors is still there. We see that equally with EPMA, despite the £78 million fund in England. Even at the end of that programme, there'll still be about 30% of organisations that won't have an electronic prescribing or medicines administration management system. Next slide, please, Jade. So what has happened over the past year in summary? Well, many digital technologies have moved forward during the pandemic. And I will say that many have. There's also been, if you go onto your social media feeds and your LinkedIn posts, or indeed any social media platform of your choice, there's also a lot of hype. And certainly for investors, for those thinking of founding a startup, for those looking at their growth patterns and growth areas and markets of opportunity, separating out that hype from the reality is, first of all, something hopefully the report can help with, but secondly is quite key to your future success. We've seen particular increases in online consultations, for example, both clinician to clinician messaging, patient to clinician messaging, mentioned on phone services, whether that's phone consultations or phone triage, huge rise in the usage of things like shared care records across the country, and also video meetings. All of those technologies have flourished in the past year. To a lesser extent, we have seen some progress with video consultations, with remote monitoring and some AI usage. But it's not universal, and it certainly doesn't look like it's going to be a significant penetration anytime soon. More traditional technologies we've touched on, EPMA, patient flow solutions. Again, they have continued to grow, and perhaps surprisingly so, where organisations have felt they can help with the pandemic, then they have pushed them through and taken them up. However, there's also been some pushback, some slowdown in terms of many procurement areas, understandably, as workloads have been prioritised and things have been either held back, stalled, or indeed stopped altogether. There's still quite limited use of technology in the care sector. Much debate during the past 12 months, both about the state of social care, care homes, domiciliary care generally, but also about the usage of technology. And I know that LaingBuisson actually have a dedicated event coming up in a month or so's time, specifically focused around digital care tech as opposed to digital health tech. And again, the 170-year-old telephone, it's my cheeky kind of controversial point, is the biggest winner of the past 12 months. I guess it's for us older people in life, more mature people in life, it's nice to see that some of that old technology has got some life in it yet. On to the next slide, please, Jade. Couple on here to highlight. I picked out a couple of the what I call breakers and makers, those people who've kind of hit the headlines over the past 12 months. Again, in the report, there is a full list and a full analysis on many of the newer, fresher companies breaking into the market. Few to highlight on here. eConsult, for example, with their electronic consultations, has seen a massive growth from some hundreds of thousands of online consultations to many millions of online consultations. Echo and other online pharmacies have seen a significant increase in repeat prescriptions being ordered. AccuRx, digital health folk legend would have it, effectively wrote their video conference solution over a weekend. I think they've probably been working on it beforehand a bit, and have rolled it out to half of the practices or more in England, and has been a significant benefit to many. And people like Elemental, in place in many communities, many of the most deprived and underprivileged communities, and being able to scale up their social prescribing offering to support organisations, not just healthcare organisations, to deliver those non-clinical, non-medical interventions. Next slide, please, Jade. So, what next? Let's look at the next year. What is the new normal? Well, I hate the phrase the new normal. I like some of the old normal. I'd like to be able to shake all your hands and share a coffee and perhaps a glass of wine later. But some things have changed. Whether they will change as we all predict they will, we will see when we get through this, and that won't be anytime soon. I think that we'll be looking at least another 2 years before we return to what might be a full or proper normality, even with the success of the success of the vaccine program. We will see an increase in that sharing of records. It will just simply be expected by the public. Interoperability will continue to be key. And I also think it will continue to be hard for a variety of reasons, despite whatever central edicts come out. The telephone will remain as the standard alternative for face-to-face consultations and appointments for me throughout this next decade. It might be that it's the mobile telephone rather than the fixed wire, but the telephone and a voice conversation will still be the easiest and simplest way for many to access healthcare. People will continue to download large numbers of apps, and Liz will talk more about that. I will steal none of her thunder later. But I think we'll start to get more into, and again, Liz will talk about this, the efficacy, the value, the usage, the outcome. You might download an app, but how good is it? Do you use it? How effective is it? And is it hitting the right people? The central NHS bodies, NHSX, but perhaps particularly in England, they will continue to push on standards. Commercially, the fragmentation and the huge number of organisations in the NHS actually creates commercial opportunity, and that perhaps is one of the dichotomies that the more there is standardisation and the larger the buying chunks, the less chance there is for a wider range of players. And the limiting factor for the usage, the adoption, the penetration, the scaling of technology in the NHS will remain money. Now, leadership, transformational change, strategy, vision, all of those things are important. But if we continue to spend little more than 2% on average of revenue on IT compared to America or the Nordics, where they're spending 8%, then the huge success that we have had with technology will still continue to be variable. It will be good in some parts and poor in others, and it won't be at the scale that is required. Next slide, please, Jade. So what next generally? Well, the pandemic is not over. Statements of the obvious are that digital health will continue to grow, and it will continue to grow over this decade. We'll see more useful AI. We will see more remote monitoring and remote technologies as people get comfortable with it. And by people, I don't just mean the clinicians or the health staff. I also mean patients in their homes. We'll see some markets offering strong growth, but not for all. For example, if we have Microsoft Teams everywhere, it does call into question other products that are knocking around on the market at the moment. Traditional technology markets persist and remain strong in terms of their growth opportunities. The scale and penetration will remain highly variable. I've often said before that actually if the NHS just took everything that's available today and deployed it everywhere, it will be in a significantly better position than, as sometimes happens, certainly at the centre, where they often focus on some of the shiny new things. Financial constraints generally within healthcare, but certainly within digital health, will be a significant factor over this next 5 to 10 year period. Social care absolutely needs to be resolved and sorted, and somebody in government needs to have, frankly, the balls to stand up and actually fix social care for the long term and make it sustainable and supportable, and then the digital can support that. And health and care will forever remain about people. It is absolutely fundamentally a people industry. And we need to think of the blended approach that will develop over time. We need to think about those who may be digitally excluded, that we need to ensure are included, the 6 million people that can't access the internet, the 9 million that can't do it without help. We need to ensure that our health services do not go backwards in their strive to adopt new technology. And I will stop there. And if you'd like to move on to the next slide, please, Jade. And the next slide, please. So I'd just like to briefly introduce our panel, and then I'm going to hand over to Alasdair as the first presenter. So we have Dr. Alasdair Emslie. We will then hear from Jocelyn, we will then hear from Liz, and we will then hear from Dustyn. So Alasdair, over to you.
Good morning. Thank you, Martin. Great privilege to be here, and delighted to be representing Lloyds Banking Group as the major sponsor. Can I have the first slide, please? So just very briefly, a little bit about Lloyds Banking Group. We have about 65,000 employees in the UK. We're the largest bank and financial services institution in the UK with some 30 million customers. We're the largest digital bank with over 16 million active users. And we have a very thriving commercial bank, having supported over 100,000 startups since 2018. Obviously, in this year, we've been highly focused working with the Treasury to deliver and support over £11 billion to clients during the pandemic in order to keep the economy afloat and to keep our individuals afloat. And we've been doing that through the corporate bank and through the retail side with flexible loan arrangements, emergency liquidity, and this has been hugely helpful in keeping economic activity going and supporting the individuals that we care for. In terms of the healthcare and digital part of the banking group, at the moment we fund quite significant numbers of GP practices, dentists, global pharma, and global tech and startups. This is an area that the bank is particularly interested in terms of developing its further portfolio and accelerating digital investment. With COVID, we have been very supportive of NHS workers. We've built in virtual delivery of banking services. We've been able to support NHS staff redeploying to home working, as well as growing our mergers and acquisitions book. So I just really wanted to give you that background and to focus now really on my area as the Chief Medical Officer in terms of how we have looked after the 65,000 staff which have delivered these amazing financial services to individuals in UK PLC. If I can have the next slide, please. So as part of our role within the occupational health services, we want to provide an end-to-end case management platform for managers to refer employees who may be suffering with mental health or other physical health problems, which might be impacting on their ability to perform or attend work. And we use a platform with our colleagues at Health Partners, which has over 2.5 million UK workers on it. We're able to take a referral from managers in discussion with the employees for the clinician to remotely assess that employee. All cases are triaged within a matter of a few hours of that referral, and they're then sent to the appropriate clinician in order to provide the optimum support and care to the employees to make sure that they and their families have the most timely support in terms of their care services. I have a dedicated team of nurses, doctors, physiotherapists, and mental health nurses who support the employees of the Lloyds Banking Group. And at the moment, we're looking at our most recent data. About 80% of our interventions with our staff are by way of an occupational health nurse, with some of the more complex cases going to a physician, like myself, a consultant occupational physician. So in addition to the sort of transactional aspect that we use our platform, we're able at a strategic level, myself, our HR team, our resilience team, and our safety teams, to look at the data in order to continuously monitor the health of the staff in the bank and to make sure that we're putting in the appropriate risk management strategies to support people through these difficult times. And as Martin has alluded to, obviously across UK PLC, for working age adults, we've seen enormous pressures on individuals, and we're seeing significant impacts in people's mental health. We've also seen real problems with people trying to access timely care through the National Health Services. So we've supported an internal ability to refer to other resources that the bank provides, which can stand in place of the NHS in terms of mental health support, counselling, virtual workstation assessments, in order to ensure that people feel safe, supported, and have their healthcare needs addressed in a very timely fashion. So in most cases, people will be seen within 2 to 3 days of referral. The advantage of moving and using this platform is that we've been able to do this entirely virtually. All the clinicians are working from home. We've been able to provide the same quality of service, irrespective of the geography or seniority of the members within the bank. And so far, we've been able to support tens of thousands of employees through the pandemic in terms of their care needs. So I feel very proud of what we've been able to do. We've been able to support people through COVID. We've been able to rehabilitate people. And of course, we're now beginning to see the effects of long COVID, and we're developing case management strategies to support people with long COVID back into employment with their rehabilitation needs. So that's just a little bit of an overview of what we've been doing in the bank. Thank you very much.
Thank you very much, Alasdair. And just while Jocelyn, who's up next, draws breath, just to remind everyone that in the Q&A section, you can upvote. Jade would tell me, upvote the questions that you would like asked. We do have some that came in before today, but if you upvote the questions, then we will try to answer as many as we can when we get to the Q&A. Over to Jocelyn.
Thank you very much, Martin. It's good to be here today. Lovely to meet you all, and we're very proud to be sponsoring this LaingBuisson report this year. Apologies for my holding my microphone like this, but it was the best non-technical solution to some microphone issues this morning, so apologies for that. Could you move the slide on, please, Jade? So just a little bit about me. I'm the co-head of the privacy team here at Gowling and also head of IT. So that is my take on the digital health sector. I'm a technology and data lawyer, so view it through that lens. I obviously work very closely internally with our healthcare sector team who bring their knowledge of the NHS and procurement and sector into which I overlay the IT and digital piece. Gowling WLG, if you don't know us, we are an international sector-focused law firm. We have 19 offices worldwide, stretching across Canada, the UK, Europe, Dubai, China, Russia, I think, hit the main offices, about 1,400 legal professionals spread across those offices. In terms of healthcare, we are a full service healthcare team, so we're not a firm with a narrow focus. We are a full service law firm, and so act for healthcare clients across corporate employment, technology, contracting, all aspects of legal advice. To give you a flavour of some of the work we've been doing recently in the last 12 months, as you might expect, we've been involved with Test and Trace, and we have a secondee there currently. We act for the Department of Health. We've been involved in some of the laboratory and testing work. And then on our private sector side, we have clients involved in remote monitoring, online prescribing, and other specific technical and digital services. Next slide, please, Jade. So my take on the digital health space, a little different to some of the others here, because I'm looking through a legal and regulatory lens. So I just thought I'd spend a few minutes talking about the key legal issues that we see when we look at this sector. And these are a range of issues, not all purely related to the technology. The first one I have here is medical devices. So looking at whether the software that is involved in the technology is actually a medical device in itself and capable of being diagnostic, and therefore subject to oversight from MHRA requiring regulation. A hurdle maybe to adoption, but also gives a level of governance and assurance, which I'm sure Liz will talk more about later. Interoperability maybe not strictly a legal issue, but I do see it as a key issue to adoption and people having faith in solutions working together, because across all sectors where I work in technology, interoperability and integration of systems is always the key risk that we see when clients take on new software solutions, be they on-premise or cloud solutions. That knitting together and integration are where the risks arise, because that's where you have the unknowns and the key failure points, and often the biggest soaks on cost as well. And of course, it's hard to incentivize vendors in a market unless they know that their systems will operate and play within the established ecosystem, because otherwise the buyers won't buy or can't buy. And in a system as complex as the NHS and healthcare and then the care sector, that interoperability is obviously key. Security is maybe a slightly different aspect of interoperability, or you can see it as a standalone topic in its own right. There are some legal implications with security, for example, on the personal data GDPR side, where the legislation requires an appropriate level of security given the nature of the data and the harm that could be caused if it was accessed in an unauthorized way. But also, again, very practically, it is key to ensure that software and systems are secure, and for the healthcare sector to know what those standards are, again, in order to be able to innovate and bring products to market, and then give buyers and patients confidence that their information within those systems is secure. And then my sweet spot, privacy and data protection regulation, that came to the fore when electronic patient records started to become something that the NHS was considering and using, and the increasing sharing of those records across different departments. Some, I think, see this kind of regulation as a blocker, but of course, as we know, the 7th Caldecott principle does require sharing of information, and that can be more beneficial than holding information back. And if you're looking at patient-centric care, ensuring their record is available to those clinicians who need it in order to treat them, but also for secondary and management purposes, in order to ensure that the system as a whole is efficient and can be supported by the private sector, is key. So ensuring that that sharing happens in a legally compliant manner under GDPR, as well as in accordance with the NHS's own rules around confidentiality, is key. And then an overriding issue, which maybe doesn't strike you initially as a legal one, is trust and transparency. I'm sure Liz will talk more about this in terms of adoption of apps, that fear, if I submit my data into a particular application, where's it going to go? Do I know that and understand it? Even if you're using some of the much more established players like Apple and Amazon, they're trying to push into this space. Do you trust them with your data? And then some people have a distrust of wider systems as well, even long established ones, because of the unknown about how that data might be used, because the perception being if it's electronic, it is more readily available and accessible, even though, of course, access protocols and rules are put in place to ensure that data is only accessed by those who have a need to know the information and who should have access to it. But I do think in terms of adoption, trust and transparency is key, and it is a legal issue as well. Through the GDPR and the Data Protection Act in this country, the regulators in creating that legislation were looking to create an environment of trust and transparency between individual and organisation, because they saw that as absolutely key to enabling the better and safer sharing of personal data, with benefits coming back to individuals through more transparent, more specific use of their data to deliver better services to them, and delivering benefits to industry, who could then innovate on the basis of data that is available and provide better services back to their community. Thanks very much.
Thank you very much, Jocelyn. And just before we go on to Liz, who's up next, just again, a big thank you to both Lloyds Bank and Gowling WLG for their sponsorship of this second edition of the book. Over to Liz.
Thank you, Martin, and I'm absolutely delighted to be here this morning with you all. So as Martin said, my name is Liz Ashall-Payne and I'm the founding chief exec at ORCHA. Now, if we move into the next slide, just to give you a little bit of a landscape about what we're interested in. So ORCHA's mission is to get high quality digital health solutions to people who need them the most. And this really sets the landscape. So we currently have access to over 375,000 digital health apps. And every day, 5 million people will download one of these solutions. But there are still some barriers to adoption. And the biggest barrier, which we've already heard about, is how can you find a solution that you can trust? So with this huge landscape, what I can tell you is that our research at ORCHA has found that only 20% of these solutions meet the quality threshold that you would expect, which means as consumers, we're more likely to download an unsafe product than a safe one. Now at ORCHA, our underpinning work is to build trust, and we've built a review and accreditation engine which assesses digital health solutions across data security, data privacy, clinical and professional assurance, and usability and accessibility. And although we're most well known because we do that job of reviewing, actually, as I've mentioned, our mission is not to review, our mission is to get the best solutions to people who need them. So using the information from the reviews and that underpinning work, we then create bespoke targeted digital health app libraries for the health and care sector. And within the NHS, we work with around about 60% of the NHS at a regional and local level, who are now able to promote the best solutions to their patients and healthcare professionals. And for healthcare professionals, they don't just want to know which products are good, they also want to recommend the best to their patient. And so through these digital health libraries, they now use that as a formulary, which starts with training and then moves to encourage them to recommend via text message or email the best solution to their patient. And then moving on to the next slide, what I wanted to do was share some of the impact and the data that we've seen since COVID on digital health. So we're absolutely obsessed with understanding what's accelerating uptake and adoption of digital health, and COVID has absolutely been an accelerator. So from a consumer perspective, we've seen a 25% increase in downloads of health apps since April 2020. We've also seen, as Martin talked about very clearly, a huge increase towards remote teleconsultations in primary care, where we've gone from 20% of consultations being remote to now 92%. We've also seen a huge increase in the number of mental wellness products being used by consumers, and also diet and fitness apps. So since 2019 to 2020, we saw a 92% increase in the number of people downloading Couch to 5K. We're also seeing reports from doctors to say that patients really appreciate, 47% of patients really appreciate the opportunity digital health brings. And it's not restricted to age. So 45% of over 75-year-olds are also willing to receive virtual healthcare and receive digital health interventions. On the next slide, you can start to see what people are searching for. So this is a heat map that we've taken from across our digital health libraries and formularies. So the darker the colour, the more interest we've seen in searching, downloading and recommending digital health apps in that space. And you can see that it's changed over time. So at the start of the pandemic, of course, people were searching for COVID-19 products. Also respiratory, people who were living with respiratory conditions, COPD, asthma, people were wanting to find digital health interventions that could support them with their conditions. Across summer to coming into autumn, we saw a huge increase in mental health products being downloaded and recommended. And then moving towards the latter part of the year, we saw a massive increase in diet and fitness. So this is around people starting to really think about their health to prepare themselves for in case they contract the virus. Now, moving on to the next slide, basically what this all tells us is that now is the time. COVID has given us a huge acceleration for digital health, and you can see there the number of increases of sessions, page views and downloads. The one that I really wanted to highlight was the increase in healthcare professionals across the NHS recommending digital health solutions to their patients. We've seen an increase of 6,500%. So at the moment, we're not able to support our patients with face-to-face consultations. This may be around people who need support for their long-term condition, remote patient monitoring. So 6,500% increase in healthcare professionals recommending trusted solutions to their patients. But there is more that needs to be done. On the next slide, you can see the two key areas that we now need to focus on to really support this acceleration moving forward. One is around procurement. We definitely need a clear and appropriate commissioning services for the purchase of digital health. We need to support these innovations to be able to sustain in the marketplace. And the second big area is around education. Trust is the biggest barrier, and we really need to support our healthcare professionals with education to build that trust, to enable them to feed these tools into their workflow. I'm really excited to take questions and be part of this panel, and thank you.
Thank you very much, Liz. That was excellent. And Dustyn, who is last but by no means least up from the panel.
Brilliant. Good morning, everybody. Thanks ever so much for inviting me to be part of the panel today, Martin. Really appreciate it. So if we could move on to the next slide, please. So I'm going to talk about my two roles, really. I'm an NHS GP, so jobbing GP for part of the week, and for part of the week I run Primary Care IT, which is a kind of tech startup designed to produce tools that help GPs with their day-to-day work. So a bit about me as a GP first. I'm the kind of person who likes to be busy, and so I've had lots and lots of different roles in my career as a GP. I've been an undergraduate tutor, I'm a senior lecturer at the local university, postgraduate trainer. I've also had management roles within CCG, so CCG board member, GP provider lead, and also STP GP representative on the ICS governing body, as well as a jobbing GP with 2 partnerships under my belt. So I'm a busy kind of person. So if we move to the next slide, please. And this is the primary care IT bit. So about 4 years ago, we founded Primary Care IT to try and share a lot of the digital tools that we'd developed in-house for our own patients and for our own practice. And this has really taken on a bit of a life of its own. We now provide tools to over 1,000 GP surgeries nationwide, as well as looking after the island of Jersey's version of QOF as well. We've grown from being just me at the outset, who was just an IT enthusiast, to now a team of 16 people who help to provide these tools out to the GP surgeries. And we're just diversifying with the help of working in partnership with other organisations into providing online consultations, remote review tools, a whole variety of solutions that sit outside of the electronic health record. So kind of two hats really. So next slide, please. So recent NHS experiences. Wow, was kind of the all I could say about that really. So just to take you back to kind of when COVID actually hit, first thing I remember about it was watching a news report and seeing a hospital being built in China and thinking, wow, what's going on there? But being busy enough at work that actually I didn't have much of a chance to look at it. And then before we knew it, life at work and in the way that we deliver primary care had changed immeasurably. So midway through March, we had quite a detailed letter from NHS England asking us to review our entire standard operating procedures as GPs, which meant that we went from having an entire appointment book for 6 to 8 weeks ahead, with all of our routine work all planned out for us with on the day capacity married in, to suddenly having to tear up that rule book and actually start to operate in a completely different way for our patients, and completely switch to providing services remotely. So for us, that meant a big change in the way that we operated, and that on top of trying to manage staff illness, staff worries and anxieties, and actually keep the show on the road for the practice was a really, really big job. So we rapidly adopted a whole load of tools that we hadn't used before. As Martin says, a lot of that was actually telephony based. The saviour for us really at that stage was AccuRx. They came along with a real simple but very, very effective product that allowed us to very easily communicate with our patients, either via text message, allowing patients to submit pictures into us, or having video consultations with our patients. And were it not for that, I think we'd have really struggled to have provided the kind of care that we were able to provide over that initial period. Because a lot of the time, if I can see a rash, or if I can dive on a video consultation with a patient and I can actually see what the child looks like, or I can have a consultation with somebody who's got mental health problems and get that kind of softer feel for how they're getting on and eyeball the situation, then that often helps massively. So it was a very, very big change for us, and a lot of the ways that we use tech, we had to think about a lot more carefully to make sure that we were using it in ways that were appropriate and that didn't introduce clinical risk into the situation. So very, very new situation for us. During that first lockdown, actually, I think it's well known that activity within general practice dropped off a cliff. So actually our demand in terms of our on-the-day capacity just seemed to evaporate, which was wonderful in one way, because it gave us the time and the headspace to be able to plan for what we needed to do over the next period of time, and think about how we can make sure that we had those plans in place and that we can manage those situations well. Then as lockdown kind of came out, there was almost a tsunami of demand, as one of my partners described it, and it felt massively overwhelming in September, October last year. So lockdown kind of lifted, and suddenly all that kind of pent up demand that had been sat at home kind of thinking about all these different things that had been going on all hit us at once. And in the kind of September, October, when we'd normally be kind of post summer and actually our demand levels are usually relatively low, it was like being in the worst winter that we'd ever had, and we were all struggling to actually manage the capacity and demand. And again, a lot of the digital tools at that stage played a really important part in that. Then we got back to more normal levels of activity, and then we were back into lockdown again. And this lockdown's been very, very different. We haven't seen the drop off in demand that we had during the last period of time. and we're beginning to see massive amounts more mental health issues, which are really, really challenging to deal with, and also seeing a lot of missed illness that just hasn't gone reported, and a lot of chronic disease monitoring that hasn't happened, and we're beginning to pick up some of the pieces for that and beginning to think about how we plan for the future. So that's a bit about the NHS experiences. If we could go to the next slide. So what has primary care IT done? We've been really, really busy trying to produce a whole load of resources for practices during COVID. So we've created templates for remote consulting. So at the early part of COVID, there was a massive expansion in the evidence about remote consulting, and which questions you should be asking and which tools were valid, and how best to conduct remote consultations. And we built all of that into embedded tools within the electronic health records that help to guide clinicians with that, and had links to the evidence and had links to helpful guides. So for example, a really easy one, somebody who's got a sore throat, actually for a patient being able to take a picture of their sore throat, there's a really good video that the GP produced that goes through exactly for patients how to take that video of the back of their throat or that picture of the back of their throat, and then they can submit that to us. And it means that the pictures that we get through are so much better quality than they would be if we hadn't done that. So we brought all of that information together and tried to have it in one place for the clinicians, and we shared that for free with all of the practices that wanted it. We also created a COVID hub that brought together, again, all of the evidence, but also standard operating procedures that some practices had created in terms of keeping clean and dirty zones, guides for how to assess staff risk, all of the kind of things that GPs and their teams would need to try and help to operate efficiently during COVID. And we had over 50,000 hits on our website over the last 12 months looking at all of those resources. And it's been nationally recognised by Nikki Kanani in the NHS Bulletin, as well as by the National LMC's newsletter as a source of good information for COVID. We've also been busy developing tools that sit outside of EMIS and the electronic health records to allow remote monitoring of patients. So if you've got patients who've got asthma, we have a tool that you can send out a remote asthma review, and actually the patients can go through a really high quality asthma review remotely, and that can link back into the practice systems, put all the data back into the electronic health record, and then our tools within the electronic health record can analyze that data and give the clinician a really good potted history. So it means when the nurse goes to do the asthma review with the patient, it can take a fraction of the time because actually all of that information is there, and the nurses can actually begin to focus on the patients that they really need to spend the time with. Again, with any tech comes massive organizational change, and actually the process of embedding that change, we've had to change the rotas within the practice so that the nurses have got time allocated to do that type of work and to review those submissions, and that isn't in a traditional way of booking appointments like it would have been before. And a lot of that is the kind of the unseen side of tech. It's actually the implementation and the change management and all of those kind of things that actually take the time and the effort and the engagement with staff. So next slide, please. So what does primary care IT do? We take GP systems, so the electronic health records, and we optimize them. So it's a bit like with an Excel spreadsheet, you can do 2 + 2 and it gives you 4, or you can create the most wonderful dashboards that give you all sorts of detailed information and allow people to interact with them and give you all sorts of insights into what's going on. It's the same with electronic health record systems within GP surgeries. If you take them out of the box, they do exactly what they're supposed to do. But if you optimize them in the best way, then actually they can provide you with a lot more contextual information about patients, and they can really make a very big difference to the speed in which the clinicians can operate, and also the safety with which they can look after their patients. So we do that by building bespoke templates, protocols, searches and alerts. We embed all of the local information into the above. We show outcomes. That's our key premise. We don't do work unless we think it's going to make a difference. And if we think it's going to make a difference, we track it so that we can prove that difference. We also have, we've been talking about already, the remote monitoring platform, and we have a large analytics platform that I think is going to come into its own when it comes to COVID recovery, because one of the key things that we're working on and noticing at the moment is that there is a lot of work that hasn't been happening in primary care in terms of chronic disease monitoring and in terms of usual business, and the difficulty with that is that that's going to go somewhere, and there are going to be outcomes from that if we don't address it. And so I think the big bit of work that we've got to do at the moment is most GPs at the moment and their teams are focused on vaccination, and quite rightly so, because it's massively important. But that does mean that some of that more routine work has been neglected, and I think a lot of the key things in the future are going to be figuring out what the priorities of patients are to start looking at, to make sure that we're looking after people safely. The kind of key things at the top would be things like cervical smears and making sure that we've got childhood IMS and vax, and we've got learning disability reviews done. And then you move on down to those people who've got chronic diseases, who need more regular monitoring and who might be uncontrolled. And then we move on to those who are well controlled but also need reviews. I'll move on to the next slide. I think that's me done. Sorry, Martin, I waffled on a little bit there.
That's all right, not at all. Excellent, Dustyn. Thank you. As excellent as ever. So thank you very much to all of our panelists. Hopefully that provided some further useful insight from them all. Once again, thank you to Alasdair and Jocelyn, particularly in terms of sponsorship, in terms of Dustyn and Liz for their contribution to the book, and also to give a shout out to two of the digital health leaders featured in the book that obviously aren't here today. Andy Kinnear, that doyen of digital health, and also James Maunder, the Chief Information Officer of the London Clinic. Whilst the panelists all come back onto the virtual stage and unmute and video themselves up and slurp their coffee, so you can just go back to the previous slide, Jade. I can tell you already that someone has already produced a meme of me saying next slide, please. I'm sure that will be on social media later. So first of all, just to plug the book again, here it is. The easiest and simplest way to avoid me having my ugly mug appear on your social media feed is just to buy one. Buy one today, why wait? Now, if you'd like to move on to the next slide, Jade. One of the things we just wanted to give a shout out to today is LaingBuisson is launching their expert network, expert insight as they're calling it, initially linked to the vast range of reports that LaingBuisson produces, and the ability to have an hour having purchased the report with the author. And obviously in the case of the digital health report, that's me. So if you contact LaingBuisson and you want to go that route to have a conversation about the report, then you can have a chat with me, a special hour. Now then, we are going to work our way through as many of the questions as we can in the time we have. We have questions that have come up today. We have questions that came in beforehand. A quick brief to panels. Please keep answers relatively short and to the point so we can get through as many as we can. To those viewing, just to say that there's some that I've got that were submitted by you beforehand, and there's also those that have been voted, upvoted, downvoted. In the panel in front of me, I have a panoply of dashboard technology in front of me at the moment, so forgive me if I get slightly confused. I'm going to answer the first question that I'd like to answer myself. Someone has asked about AI, agreeing that it's still in the hype phase, but what particular areas that are worth focus, and how do buyers, founders, investors cut through that hype? I'd pick one area. I think that diagnostics is going to be a big area for positive impact of AI. We're already seeing that in a number of projects that are taking place around the country. And secondly, I think one of the ways in which you can look through the hype if you're an investor, nothing wrong with having clever maths, nothing wrong with having algorithms, but if you start to call it AI, obviously that immediately drives up both the cost of investing and of course it also drives up the multiple for exit. So those that are purchasing and those that are investing might want to just assure themselves that they are actually investing in AI, which from recent research would suggest is only true in about 10% of cases. Now, my first question to the panel is going to be to Liz. Liz, you highlighted the 20% good, 80% bad as one of your figures, if I can put it simply like that. How do we ensure that these digital tools actually are both good as a tool, but also impact on health outcomes in a positive way?
Yeah, really good question, and this is a long answer, so I'm going to do it as fast as I can. We have currently a whole regulatory puzzle. There are thousands of regulations that could be applied to a digital health solution around data security, data privacy, clinical validity, user experience, and actually it's not a static situation. New regulations are emerging all the time in the world of digital health. And what we've seen globally is that new assessment frameworks are starting to come to life. So somebody commented in the Q&A about the DIGA, which is an assessment framework in Germany, and we see that the NHS is currently revising the DAC to the DTAC. And what those assessment frameworks are trying to do is make sense of that crazy world of standards and regulations. There are a few challenges around that. One is, as somebody put in the chat, you can't just do an assessment once. These products change and update all the time, so you have to be in a position where you can re-review, and that's one of the challenges. The second is the regulatory landscape changes all the time. And obviously there are regulators out there, for example, notified bodies who assess for medical device directive and soon to be regulations. But what we're doing is we're pulling and coordinating reviews and assessments across all of those different domains, and supporting everybody to know which ones are the best in a repeatable way. And the only way to do that is to incorporate technology. So we need a new approach to driving regulation and assessment. Sitting in a room for 18 months trying to assess this around a table on pen and paper is not going to work in this new digital age.
Thank you, Liz. Another one I'm going to quickly answer. So someone's asked about the move to cloud. The move to cloud, I think, will continue at some reasonable pace. Some countries, for example, the US in healthcare, are already quite far down that road. There is that split, of course, between private cloud, which I would imagine most people use, and public cloud, which may be, I don't know, but may be the inference of the question. Certainly the move towards private cloud, I think, will continue. I think there'll be increased usage of public cloud. There still will, however, be a legacy of on-prem, because people have invested in very expensive data centers, and turning around to your trust or organizational board and saying, that thing we built 3 years ago, we don't need anymore, is quite a hard thing to do. So I think that will increase over time. A question for Dustyn then. You touched actually on this in terms of remote diagnostics. In terms of remote diagnostics, Dustyn, and remote monitoring, if I can lump those two together, how do you see that progressing over the next, say, 5 years?
I think we're going to see a huge explosion in that area. It's definitely one to watch in terms of what's going on. As GPs, we've been picking apart everything we're doing and thinking, what do we have to do in practice and what can we get achieved remotely? And the key things that we have to get patients in for at the moment are for blood testing, for certain physical health checks where their patients are unable to conduct them themselves. So blood pressure springs to mind, things like pulse checks and those kind of things. And I think as the technology in this area begins to move on, and we've seen some very, very exciting products that are able to remotely analyze blood pressure and a variety of other other observations simply by using a smartphone. And I think as those are embedded in practice's usual workflows, I think this is going to be a real area of expansion and a real area of growth over the next period of time. And that will allow a changing, I think, of the entire healthcare environment, because it will allow certain areas of care to potentially be done not in the traditional way by their own GP, but particularly by other providers who may be able to take bundled packages of care and actually provide that remotely as interoperability begins to open up. And I can see that being a real area of growth over the next period of time. I think it's a really exciting area to be in at the moment.
Okay. Thank you, Dustyn. Another one that I'm just going to quickly answer that's reached the top of the shop around the digital health and remote patient monitoring companies that have gained some attention in the UK and Europe, and how do we see that going post-COVID? Well, I think Dustyn, in some respects, and indeed Liz before, both answered that question in the sense of that their growth will continue. I think a comment I would make is it's quite interesting how parochial, how country-based a lot of healthcare technology is. Whilst we can all come up with, you know, probably 20, you'll say, well, there's loads. Yeah, there might be 20 examples we can come up with that are international. I could come up with 2,000 that haven't moved beyond their home geographic territory. So there is a real issue of scaling, of translation of services from one geography to another, which the digital healthcare technology industry needs to tackle. Okay, a question for Jocelyn, if I may. Given especially your background and experiences, so organisations, healthcare providers in particular, who are not implementing digital technology or not implementing it at the scale that they should be or appropriately, how does that impact on their risk profile, the likelihood of them being sued, the other legal type implications that they might come across through their lack of digital maturity?
I think when you look in the healthcare sector, it's not like a private sector that's open or completely open to competition, where you might say, well, if you fail to implement digital solutions, you're going to fall behind and lose market share. It's a different picture because we're thinking about outcomes and patient care. From a risk perspective, though, in implementing technologies, you clearly have to make sure you do that in a legally compliant manner and with sensible technical standards and backups as well, which can be hard for some health sector organisations, because unless you have someone like Dustyn leading the charge, you're not a technology specialist, and it's a new area to get to grips with. So I think risks arise through needing to bring in expertise and people who understand this area to make sure these kind of implementations are done in a compliant manner, and not just thinking about the technology, but thinking about the data aspects as well. Whilst everyone is comfortable with how you secure personal data and handle it in paper form, moving it so it becomes electronic does create new risks, because then it is accessible remotely by people who ought to have access and people who ought not to have access. And so you have to understand, how do I do that in a safe way, which is partly a legal question and partly a technical and operational question.
Thank you, Jocelyn. So a question for Dustyn before I come to Alasdair. Dustyn, you seems like a good one for you. What is the single most important obstacle of video consultations growing much more rapidly versus the telephone?
I think probably the timing and the way that video consultations are usually instigated. So, and the development of the technology that sits behind that. So everybody has a phone, everybody understands how to use their phone and make telephone calls. If you look at every phone that most people have got these days, you can make video calls on them as well. But people of my age don't tend to reach for a video call as the first way of making a telephone call. We tend to make a telephone call. Whereas if you look at my children's usage of their telephones, they reach for a video call every time and never use a telephone. And I think some of that is just about the way that we've been used to accessing technology and using it. And I think the younger generation will automatically pitch for video as opposed to the older generation, and that's just a generational thing. So I think also the technology needs to improve a little bit. So some of the tools that we use within IT systems at the moment, there's several clicks before I can launch a video consultation, and the patient may have to download an app. And for my 70-year-old plus patients, not to stereotype, but they do find that more of a challenge, and actually walking them through that process can take me 10 or 15 minutes. And so if I'm having a very busy day, I may not have the capacity to be able to do that. So I think some of it is about simplifying the tech so that it's much easier just to click to it, and so that it's, I mean, ideally it just pops up on your phone exactly the same as FaceTime, or exactly the same as Zoom, or exactly the same as the other platforms that most elderly folk have now had the coaching and the training from their families to be able to use to help them through the pandemic, and that will then drive up the adoption of these kind of technologies. But I think its usability and user experience is key.
Okay, thank you, Dustyn. Alasdair, so workforce, significant portions of the workforce either furloughed or indeed working from home over the past 12 months. How has digital health helped occupational health in terms of managing the healthcare of that corporate workforce?
Thank you. Well, the first thing that we had to do, rather like Dustyn in primary care, was to move a lot of clinicians to remote working. Luckily, our system is all cloud-based, and we were able to do that. really over 48 hours, which was great. We've also had to stand up new products. The most important one was initially to do COVID risk assessments on people to identify those who were clinically extremely vulnerable. Obviously, some people got shielding letters from their GPs, from their hospital specialists, and from NHS Digital. But actually, one of the problems was that if you had lots of different illnesses, the comorbidity alongside age, that was often not captured. So we've done tens of thousands of those risk assessments. We've also had to stand up end-to-end COVID testing to keep companies open, to keep organizations open, where they have to still put people on site, because obviously there are a significant number of organizations that can't go remote, particularly blue-collar working areas, construction, refurbishment, all these sorts of areas. So putting an end-to-end testing program and creating the digital platform in order to do that, and to report the results in a timely way to Public Health England, so that the government has that figures. So those are the sort of key things that have really been challenges for us as an organisation. We've met those challenges and we've delivered really seamless medical support throughout to the 2.5 million employees or thereabouts on our system.
Thank you, Alasdair. Another question that's come up, we have seen the big silicon companies, Apple, Amazon, Microsoft, etc., circling health, but how do you think they will further penetrate health with software versus hardware? I'll take that one. I'll go a step further, actually, software versus hardware versus services, although we have seen some backtracking on the service provision from some of these big US tech. Big US tech, obviously, given the nature of the US healthcare system, have been fascinated by probably driving down their own costs and whether it creates a business opportunity for them, either standalone or typically in partnership with US healthcare providers and others to deliver healthcare to their own workforces, reducing their insurance premiums, etc. They have struggled with this for some time. My feeling is that over the next 10 years, back to a question earlier where I made the comment that a lot of health technology is quite localized. Of course, these big tech players are absolute experts at globalization of their solution offerings. I think that we could see, for example, Amazon completely sweeping the remote online pharmacy business in the UK, I think, and across Europe potentially. I think we will see healthcare services potentially being offered by these big health tech players. They may do it in partnership, they may do it with a brand name, and the UK and the NHS is a very strong brand, and there are some organisations that have particularly strong brands. But I think the rise of the big US tech in healthcare will continue over this next decade. Now, Jade, I'm looking for the whisper in the ear. We're 12 minutes past. Have we got time for one more question? Let's go to, in other countries, focus is shifting rapidly to at-home care and community-based care supported by digital technology. Are we seeing this as a major move in the UK? And is this on the NHS agenda? Perhaps I could give this initially to Liz, maybe to comment on how can digital health support that? And also then to Dustyn, just to follow up briefly with a what he's seeing happen in that home care at home space digitally. Liz.
So I think there is pockets where that's happening. For example, we work with a home care organisation who are really keen to promote high quality solutions to the people they're caring for. I think we're also seeing an increase in healthcare settings suggesting digital health solutions to people so that they can remote care and remote monitor. But we're only seeing this in pockets. And I think one of the reasons why is because what COVID has done is digitized the current. So we've digitized the way in which we have predominantly previously seen patients, or teleconsultations. And I think what we now have is an opportunity to really scale some of the greater opportunities that digital health brings. And the reality is, if you're a GP, and I'm sure that Dustyn will be able to attest to this, at the moment, you might not be able to send a patient for diagnostics. You might not be able to send them to clinics to get support for their managing their long-term condition. So what do we do? Well, actually, there is a wealth of opportunity within the digital health space. We just need to know which products we should be recommending to patients to enable that to happen at scale and pace. And so I suppose that my big ask is, please don't think that we've done innovation. That box is yet to be ticked. We've started a journey.
Okay, Dustyn, you've got just a minute, less than a minute. Very quickly, can you just give us your thoughts on where you see it going?
Yeah, I totally agree with Liz. I think there's so many different avenues that you can go down with this. I mean, some of the stuff we've seen around being able to do pulmonary rehab through using VR has been massively impressive, and I think it's completely meant that our traditional model of delivering care can be done much more effectively at scale and safely during COVID. And I think that and you go down all sorts of different avenues with all the different types of care that we currently provide, and you think every single one of them has opportunities and has ways that we can do things differently and better using tech. So I think a big part of it for commissioners and for the NHS in general is to think, okay, we've got all of these different avenues and different opportunities. How do we bring these together into something that's manageable and something that's planned and something that we can show outcomes for? And how do we control it? Because you have got certain areas running ahead of the game, and you have got certain areas where actually we're lagging behind a little bit. And how do you make sure that everything is brought up to a good standard, whereby everything is running as optimal as it possibly can be? And that's probably going to take us years to achieve that, but it's a very exciting area to be in.
Thank you, Dustyn. Thank you, Liz. Thank you to all of our panelists today. Thank you so much. Great contributions. Thank you to all of you out there in the wider world for attending. Hope you've enjoyed the past hour and 15 minutes. I'm not going to have a Bob Geldof moment, but you know where the book is. Please buy and enjoy the rest of your day and have a very lovely week. Cheerio.